It's estimated that 4 to 5 million people experience gastroesophageal reflux disease each year. The stressful and fast-paced lifestyle most Americans are accustomed to is a major factor in this digestive epidemic. As we often do, we attempt to alleviate the discomfort caused by GERD with medication. In this clip, Dr. Ruth Buczynski interviews Dr. Elizabeth Lipski about the causes and effects of GERD and the importance of establishing a healthy lifestyle to control it instead of the short-term drugs used to suppress a potentially long-term problem.
Our guest today is Dr. Elizabeth Lipski. She's a board-certified clinical nutritionist from Asheville, North Carolina, and she's the author of Digestive Wellness and also Digestive Wellness for Children. Let's go in now to talking about an integrative approach to preventing and alleviating symptoms of GERD.
Okay. So GERD is a fancy name for heartburn or acid indigestion. It's gastroesophageal reflux disease. And what is actually happening there is that the hydrochloric acid and the gastrin and the stomach contents actually back up into the esophagus where they don't belong, which is why it's called reflux. And so people feel in sour stomach, indigestion, heartburn, and this is, one of the biggest health issues that we have going today. And when I was a kid, we'd see those Alka-Seltzer commercials, acid indigestion, take Alka-Seltzer, and Alka-Seltzer does work because it neutralizes that stomach acid that's causing that burning. What we know is that there's over 4 to 5 million people who are experiencing this every year. And it's a big issue. I think 3 out of the top 20 best-selling drugs are heartburn drugs. Gastroenterologist, who's a friend of mine, Jerry Mullen at Johns Hopkins, calls all the medications that we're using for everybody, he calls them the heroin of our times. Because people are so addicted to these medications that were designed for us to use and approved for us to use for up to 3 months. And so, again, this is where the body-mind connection is so important. A lot of GERD is really, really, really due to stress. And so stress is such a huge place where it plays a role, and is the reason why this is such a ever more increasing problem in our culture. The other place that stress plays a huge role in this is that stress tends to turn down our body's ability to make hydrochloric acid. And so a lot of people who are diagnosed with GERD actually don't have too much acid. They have littler amounts of acid. And so, but what happens is then the stomach starts churning more and more, and then pushes this acid to reflux back up through because it's trying to make more with less. So some people with GERD have too much stomach acid. Some people have too little. And again, Gerard Mullen from Johns Hopkins says when he scopes people, a lot of people aren't actually even having stomach acid reflux. They're having bile reflux back up into their esophagus. So there's still more that we don't understand about this. So again, the first places that I start to look is stress management. The second place that I look is I do what's called a hydrochloric acid test, where I have somebody take 1 tablet of betaine hydrochloric acid that they can pick up at a health food store and take 1 of those tablets with a meal that they have protein at, so beans or fish or chicken or red meat. And the normal response for somebody who has good stomach acid is that they should feel worse somehow after they took that. If you already have enough acid and you take more, it should feel worse. There are also more sophisticated tests, the Heidelberg capsule test, and some other tests that gastroenterologists are now using. There's one called the SMART pill to determine really what's going on. And then the other things are thinking about, again, a lot of this is food sensitivity induced. Dr. Jonathan Wright, who's one of the pioneer physicians in nutritional medicine, says that this is often related to food sensitivity. So, again, an elimination diet, seeing how if that works. Also, sometimes it's actually structural. Sometimes people have hiatal hernia, and they can go see a chiropractor or an osteopath who actually does some gentle manipulations, and the GERD just disappears. Especially in babies that have GERD, there's some really gentle manipulations that you can do with babies, and it just stops. But again, there's so much that can be done before people start taking proton pump inhibitors, because the long-term effects of taking all those acid-blocking drugs is we're starting to see osteoporosis and other mineral deficiencies. Research is just starting to come out, which is bound to happen because we use the hydrochloric acid to protect us against food poisoning, parasites, and also for absorption of minerals, calcium, magnesium, zinc, copper, iron. So when you're blocking acid, you start causing depletion of minerals over time.
There is more to learn about holistic approaches to digestive health. For more information, visit our blog at www.nicabm.com/nicabmblog or attend a free teleseminar at www.nicabm.com/teleseminar/2009. There you will learn the effects of leaky gut syndrome, the importance of pre- and probiotics, an update on IBS, and more. This December, NICABM will host its 21st International Psychology of Health, Immunity, and Disease Conference on the beautiful Hilton Head Island in South Carolina. Hundreds of practitioners will be coming from all over the United States and many parts of the world. Among the nearly 50 speakers, Dr. Lipski will be teaching a session on digestive wellness and the systemic consequences of imbalance. There will be several sessions on related topics, including sugar sensitivity, unmasking the hidden dilemma in treatment, mindfulness-based eating awareness training, and micronutrient deficiency fuels food addictions. To see more information about the upcoming conference and to sign up to attend and receive CE/CME credits, please visit www.nicabm.com.